Good morning and good afternoon, distinguished representative, ladies and gentlemen. I have great pleasure in declaring the 74th session of the World Health Organization Regional Committee for the Western Pacific open. I will now deliver my opening address. Honorable Ministers, distinguished representative, Director General Dr. Tedros Ghebreyesus, Acting Regional Director Dr. Susanna Chakap, representative of Agency of the United Nations Intergovernmental Organization and non-governmental organization, distinguished colleagues, ladies and gentlemen. It is my great pleasure and honor to welcome all of you to Manila and the 74th session of the WHO Regional Committee for the Western Pacific. I'd like to begin by thanking member states, the WHO Secretariat, and our partners for their hard work and achievement over the past year, as well as the exhaustive preparation for this special regional committee, where we will nominate our next regional director. I would now like to report to you on some of the progress that has been achieved since we last met. This time last year, we have a panel discussion on communication for health. I am pleased to see the application of the communication for health approach has been further strengthened in the region toward its establishment as a technical program. The draft of the Regional Action Framework on Communication for Health, a vision for using communication to improve public health in the Western Pacific region. Thus, we will discuss at this meeting in the results of the ongoing work in designing communication intervention which inform and change attitude behavior that support essential public health outcomes. This approach is aligned with WHO global efforts, including achieving well-being, a global framework for integrating well-being into public health, utilizing a health promotion approach adopted at the World Health Assembly in May 2023. One of the technical agenda items we deliberated was non-communicable diseases, where we endorsed the Regional Action Framework on non-communicable disease prevention and control in the Western Pacific. Combating the NCD epidemic is one of the cornerstones for the future toward the healthiest, safest region, a vision for WHO work with the member states and partners in the Western Pacific. Although progress is being made, reducing premature NCD mortality in the region has slowed down or some places reverts. This is a large part due to little progress made in the risk factor reduction targets. The multi-sectoral nature of WHO work on this issue go beyond partnership with the health sector by championing health across multi-sectors. The next technical agenda item was primary health care, which is critical to achieving universal health coverage. The health-related sustainable development goals, we express our concern that many individuals and households continue to face financial hardship, with 1 in 5 people pushed into poverty due to health expenses. This inequitable access to care persists in the region. I'm pleased to see that over the past year, important progress has been made in stimulating PHC reforms and building and strengthening resilient health system through the development and implementation by member states of the regional framework on the future of primary health care in the Western Pacific was endorsed at last year's regional committee. The third technical agenda item was reaching the unreached. There are still groups our health services fail to reach in every country and area across our region. And as a result, have poorer health outcome. The COVID-19 pandemic brought into focus on health equity and the importance of health system that can efficiently reach everyone and maintain delivery of essential health services, even during health emergency, to leave no one behind. The regional framework for reaching the unreached in the Western Pacific 2022 to 2030 that we endorsed last year aims for comprehensive and inclusive healthcare access. The framework emphasizes notifying primary healthcare using an integrated system approach, empowering community and individuals, and addressing socioeconomic hindrance to primary care, and encourage the engagement community organization and civil society in the pursuit of health for all. Since its endorsement, efforts have intensified to identify the unreached population and adjust our approaches to strengthen the core components of primary health care. Additionally, WHO has initiated an integrated on-power dashboard enhancing data-driven equity analysis, further bolstering efforts to reach the unreached. The regional committee also endorsed the strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific, which builds on existing global strategies, offering broad guidelines to member states to develop and strengthen their national cervical cancer control programs, ensuring sustainability towards achieving global targets for the elimination of cervical cancer. Since its endorsement, WHO has been working with the member states to align national cervical cancer plans with a strategic framework focusing on service integration, HPV vaccination, and appropriate human resource development tailored to the national context to meet the 90-70-90 cervical cancer elimination target by 2030. We advocate that the human papilloma virus vaccine or the HPV vaccine be included in the national immunization programs to vaccinate 90% of guns before the age of 15 to protect the next generation. However, data recently published in the Lancet suggested that progress is limited with the coverage of the first dose of HPV vaccination remaining very low in the Western Pacific region. The fifth and final technical agenda item at the 73rd Regional Committee meeting was mental health, with our endorsement of the regional framework for the future of mental health in the Western Pacific 2023-2030. The provision of quality mental health care in many settings is still limited, depriving too many people across the region of rights-based healthcare and support. Integration of mental health into primary healthcare, addressing mental health needs of children and adolescents, suicide prevention, training, and retaining the appropriate skill mix of competent health and social care professionals, and increasing funding in mental health services are key priority tasks for the member states. Thank you again for entrusting me as the chair of 73rd Regional Committee meeting. It has indeed been a busy year for the Regional Committee, including most recently as we successfully held our first candidate forum, an important step toward strengthening transparency. I'm grateful for last year's office bearers for their support, especially the Vice Chair's assistant during the special session. And I'm thankful to the WHO Secretariat for all the efforts to support country over the past year and the preparation for this 74 Regional Committee meeting. Thank you very much. Before we continue a special celebration the 75th years of World Health Organization, may I introduce the Global Sculptures and the Vipro Music Company. You may recognize the Global Sculpture from this year World Health Assembly, founded by Dr. Emma Brian, frontline health and healthcare workers and head of music therapy at the Royal Melbourne Hospital, Australia. The sculpture connect with hearts and minds and transcends traditional silos of healthcare delivery. Let us now welcome Dr. O'Brien, member of the Global Sculptures from across the Western Pacific and the Vipro Music Company, to launch a new collaboration celebrating the extraordinary work our health and care workers do every day.
Thank you. Thank you for that kind introduction. I'm Dr. Emma, and I'd like to say thank you very much to all the honourable ministers and distinguished delegates for having us here today. This is a very special time for me and for all of Scrubfire. I've been a healthcare worker for 25 years, and it's an honour to be here in the region. So the Global Scrub Choir began at the Royal Melbourne Hospital in response to the stresses of the pandemic for the healthcare workers. And our partnership and collaboration with the World Health Organization began earlier this year at the 5th Global Forum for the Healthcare Workforce with the theme of Protect, Invest Together. And we have also, as you heard, have now had the honour of performing at the World Health Assembly and most recently at the United Nations General Assembly, working together with the World Health Organization for better health for all. Global Scrub Choir is all about caring for the carer so we can continue to care for you. And I thank you all for all the work that you're doing to help us do our work too. So this is a very special song with a very special group of people coming to sing for you today. You'll see on the video as we sing thousands of healthcare workers from across the Western Pacific region. This is our first project in this region, and I hope that we do many more. You'll see the names of the countries of the people that are involved, and I'd now like to welcome onto the stage members from those countries and the Whitborough Music Company. So these are all healthcare workers. And the importance of Global Scrub Choir is that it's everyone that's involved in health and care that is part of it. So doctors, nurses, therapists, CEOs, administrators, they're all welcome to join. We wanted to find the right song, and I've heard earlier this morning in your remarks, Chairperson, about reaching out across the region to support one another, because when we collaborate, this is when we do the really good work. And the pandemic has showed us that we can do this, and it has also showed the value of collaboration and compassionate care. So, I'm very pleased to introduce you to our song, Reach Out, I'll Be There. It's a 1960s classic, but done Global Scrub Choir style.
Because all
Thank you so much to the Global Sculptures and Vipro Music Company. Item 3, election of the new officers, chairpersons, vice chairperson, and rapporteur. We now consider the next item, the election of the new officer beginning with the chairperson. Are there any nominations for the office of chairperson? Kiribati, your floor.
Thank you, Chair. Kiribati would respectfully like to nominate Brunei Darussalam for the post of chairperson of the 74th session of the WHO Regional Committee for the Western Pacific. Thank you.
Thank you. The representative of Kiribati has nominated the representative of Brunei Darussalam for the office of the chairperson. Are there any seconders? Cambodia is Cambodia.
Here, Excellency, ladies and gentlemen, I the second motion nominating Brunei Darussalam to be elected for the post of chairperson.
Thank you. The representative of Cambodia has seconded the representative of the Brunei Darussalam for the office of chairperson. Are there any other nominations? Malaysia, please.
Thank you, Chair. Malaysia nominate Mongolia to be elected for the post of vice chairperson. Thank you.
We will not go there yet, so the vice chair will be continuing. It's just a chairperson. So if there are none, I have a great pleasure in pronouncing the representative of Brunei Darussalam, the Honorable Dato Dr. Muhammad Isham Jafar, Minister of Health, as a chairperson. I thank again the other officer of the last session and wish the new chair the very best for this meeting.
Thank you, Honorable Minister. Distinguished representatives, I thank you all for electing me as chairperson for the 74th session of the Regional Committee for the Western Pacific. I would like to ask your indulgence in allowing me to postpone my address to the committee until tomorrow morning. We now proceed with the election of the vice chairperson. Distinguished representatives, are there any nominations for the office of the vice chairperson? Malaysia.
Yes. His Excellency, Malaysia would like to nominate Mongolia to be elected for the post of Vice Chairperson. Thank you.
Thank you. The representative of Malaysia has nominated the representative of Mongolia for the office of the Vice Chairperson. Are there any seconders? Federated States of Micronesia.
Thank you. The Federated States of Micronesia would like to second the nomination for Mongolia to be this vice chairperson of the 74th RCM. Thank you.
Thank you. The representative of the Federated States of Micronesia has seconded the nomination of representative of Mongolia for the office of Vice Chairperson. Are there any other nominations? There being none, I have much pleasure in pronouncing Dr. Sof Stokes Dilger, Acting State Secretary and Director of Department of Monitoring, Evaluation and Internal Audit, Ministry of Health of Mongolia, as Vice Chairperson. Now we come to nominations for our rapporteurs. May I ask first for nominations for the office of rapporteur for the English language? Palang?
Thank you, Chair. Palau would like to nominate Japan to be the English rapporteur for the 74th RCM. Thank you.
Thank you. The representative of Palau has nominated a representative of Japan as English rapporteur. Are there any seconders? Cook Islands, please.
Thank you, Chair. The Cook Islands second the motion nominating Japan to be elected for the post of rapporteur in the English language. Thank you.
Thank you. The representative of Cook Islands has seconded the nomination of representative of Japan for English rapporteur. Are there any other nominations? There being none, I have much pleasure in pronouncing Dr. Saki Nakamura from Japan as English rapporteur. May I now ask for nominations for the office of rapporteur for the French language? Australia.
Thank you, Chair. Australia would like to nominate France for the French rapporteur.
Thank you. The representative of Australia has nominated a representative of France as French rapporteur. Are there any seconders? Fiji?
Fiji seconds the nomination of France for the post of rapporteur in the French language of the 74th session of the WHO Regional Committee for the Western Pacific.
Thank you. The representative of Fiji has seconded the nomination of a representative of France for French rapporteur. Are there any other nominations? There being none, I have much pleasure in pronouncing Ms. Francisca Fontes from France as French rapporteur. Thank you very much. Congratulations to my fellow office bearers, and I look forward to working with you all to ensure a smooth and efficient meeting this week. With that, we will move to the next agenda item. Distinguished representatives, document WPR/RC74/1 revision 3 contains the provisional agenda. Are there any comments? In the absence of comments, the agenda is adopted. Distinguished delegates, now that we have adopted the agenda, I would like to note that under agenda item 16.6, we will consider possible amendments to the rule of procedure of the regional committee. Member states have been extensively consulted in this regard prior to the regional committee sessions and were invited to provide comments on the proposed amendments through note verbals from the Secretariat sent on 21st July 2023, 4th October 2023, and 13th October 2023. I would therefore like to propose that the regional committee suspend Rule 53 of its rules of procedure, according to which amendments to the rules may be adopted, provided that the committee has received and considered a report by an appropriate subcommittee. Is my proposal agreeable? I see no objections. It is so decided. It is now my great pleasure to invite Dr. Susanna Jacob, the Acting Regional Director, to say a few words. Dr. Jacob, the floor is yours.
Thank you very much, Mr. Chair, honorable ministers, distinguished delegates, ladies and gentlemen, Director General of WHO. Welcome to the 74th session of the Regional Committee for the Western Pacific. We are delighted to welcome you back in Manila this year and to host this session on the premises of the regional office. Each year, the Regional Committee is a very important gathering. However, this year it is especially so for a few key reasons. First, this year marks 75 years since the founding of the organization. The story of WHO is one that is co-authored by you, our member states and partners. It is a story that spans 7 decades of collective achievements in public health, driven by science, solutions, and solidarity. During the week, I invite you to explore the photo exhibit just outside, which celebrates some of these health milestones and accomplishments we have achieved together. This regional committee is also a significant one, as the next regional director will be nominated to a 5-year term, marking the start of an exciting new era for this region. The incoming regional director will assume substantial responsibilities as health challenges grow in scale and in complexity. Yet, I have every confidence in our candidates' capabilities to lead this region forward. I extend my best wishes to all the candidates for tomorrow's nomination. Beyond the regional director nomination, we have a number of other important items on the agenda. These include both global and regional issues, all of which are priorities for the Western Pacific. Among them are 4 important technical items on health security, health innovation, communication for health, and health workforce. Other issues will be addressed, such as governance, implementation of global decisions, and transformation of the regional office to ensure it is a respectful workplace. These topics are so important for this region and key to driving forward the priorities that have been laid out for the future vision of the region that you adopted in 2019. I thank you all for your contributions and look forward to the discussions. Thank you, Chair, and back to you.
Thank you. Thank you, Doctor. Now, I would like to invite the Secretariat to provide a short briefing on how we will organize our work this week. May I now call on the Executive Officer of the Office of the Director of Program Management, Dr. Lee Yu. Dr. Yu, over to you.
Thank you, Mr. Chairperson, and good morning, honorable ministers and distinguished delegates. May I have my presentation on the screen, please? With a nice opening and singing, I believe that we are all excited to move to our agenda items. I would like to start with some information on the meeting times. All the times I will be mentioning are in local time in Manila. The working hours of the session meetings are from 9 a.m. to 5 p.m., except for a longer meeting time on Tuesday for the RD election. There will be a coffee break from 10:15 to 10:30 in the morning and 3:15 to 3:30 in the afternoon every day, except for Tuesday. During the nomination of the regional director on Tuesday, there will be no coffee break. Having said that, coffee will be available outside of the conference hall. Lunch is from 12 noon to 2 p.m. every day. Again, except for a shorter lunch time on Tuesday to allow more time on the RD election. On Wednesday and Thursday, we will have 1 hour side events in the conference hall from 12:45 to 1:45 p.m. Regarding the management of agenda items, and item 6, the Director General will address the regional committee. It will be immediately followed by item 8, the acting regional director's reports, which will be presented by the Secretariat as a team. We request that member states combine their interventions on this item with those for item 6, DG's address. And item 7, a new regional director will be nominated in a private meeting. For item 9, program budgets, sub-items 9.1 and 9.2 will be taken together. So we request that member states combine their interventions on these sub-items. For item 10, the panel discussion on charting the costs, rethinking health financing for social well-being and sustainable development will start at 2 p.m. on Wednesday, irrespective of progress on the rest of the agenda. There are 4 technical items with regional action frameworks for consideration of the regional committee. These items will be taken in the following order: health security, communication for health, health innovation, and health workforce. For item 16, coordination of the work of the World Health Assembly, the Executive Board, and Regional Committee will be taken in 3 separate parts. For item 16.1, 14th General Program of Work, Results Framework, and Investment Round will be started this afternoon. For item 16.6, Rules of Procedure of the Regional Committee for the Western Pacific region, and items 16.4, Transformation of the Regional Office, including Organization of Workplace Culture Change, will be discussed on Wednesday. Member States' intervention for item 16.6 and 16.4 will be taken separately. Moving to Thursday, item 16.3, WH's work in countries will start at a fixed time of 9 a.m. on Thursday, irrespective of progress on the rest of the agenda. Item 16.5, items recommended by the World Health Assembly and Executive Board will also be discussed on Thursday. Item 16.2, agenda for the 75th session of the Regional Committee for the Western Pacific in 2024 will be held on Friday, together with item 18 on the time and place of next 2 regional committee. Moving to Friday, we will have item 15, progress reports on technical programs. Delegates are requested to kindly combine their interventions on the progress reports. For remaining items 17 and 18, this will be handled in a usual manner with a brief introduction from the Secretary, followed by Member States' interventions. If additional time is needed to complete discussions, session hours may be extended until 6 p.m. on Wednesday and/or Thursday. Rapporteur meetings would then occur immediately following the extended session on those days if necessary. Regarding the side events, this will be on Wednesday and Thursday during lunchtime. The first on Wednesday is the transformation of the regional office, including organization and workplace culture change. And the second is on climate resilience and low carbon health systems, which will take place on Thursday. Finally, a few remarks on some practical matters and helpful tips. Member States are kindly requested to limit their interventions to 3 minutes. A timer will show on the screen. If you are sending in or reading an intervention, 3 minutes means less than 300 words. When you wish to adjust the session, kindly press the big button on your microphone and wait until the small light turns green to start speaking. May I take this opportunity to remind the distinguished representatives that the written copies of your interventions can be extremely helpful for the report writers to capture your important comments. So please send them along to the RCM mailbox listed on the slides. Draft resolutions will be made available through the RC74 SharePoint portal as of tomorrow morning. These were prepared before the start of the regional committee meeting to facilitate the committee's work. Of course, revisions can be made to reflect points that arise during discussion on specific agenda items. Whenever possible, please send any suggestions on the draft resolutions to the Secretary through the RCM mailbox before 3:30 p.m. on the day of the discussion of the item. This ensures that rapporteurs will be able to adequately capture your suggestions when they review the resolution during the rapporteurs' meetings. Also, rapporteurs usually appreciate when specific wording is provided, that is, the specific wording you desire in your recommendations. Lastly, my chairperson, I have been asked to advise delegates that we hope to be able to continue with the Western Pacific region tradition of making the regional committee meeting a healthy meeting, including mobility breaks throughout the session. And I'm very pleased to see all the delegates in person finally in this conference hall. And we are looking forward to seeing delegates participate in these healthy mobility breaks. Thank you very much, Ms. Chairperson.
Thank you very much, Dr. Yu. As Dr. Yu mentioned, we ask all honorable delegates to keep your interventions concise this week, as we do have a very busy program. I look forward to working with you all to get through our very busy agenda. There is one other important issue I would like to briefly mention as chair of the RCM. As you are all aware, WHO has zero tolerance policy for any form of harassment and sexual misconduct at any WHO event or WHO premises. The organization is committed to enabling events at which everyone can participate in an inclusive, respectful, and safe environment. All participants are expected to behave with integrity and respect towards each other, and everyone is involved in this event. If a participant has a concern, please speak to Ms. Dakshini Gunaratne, Prevention of Sexual Misconduct Management Officer, and Mr. Arpit Agarwal, Acting Director of Administration and Finance of the Organizing Committee. Reports or complaints can also be made to WHO Office of Internal Oversight Services at investigation@who.int.who. WHO also has a zero tolerance policy for inaction in these cases. So all concerns will be handled consciously and confidentially. Lastly, I would like to ask if you can speak slowly and clearly into the microphone. This is very important for the interpreters. Distinguished representatives, ladies and gentlemen, it is now my great pleasure to invite our Director General, Dr. Tedros Ghebreyesus, to deliver the Director General's address. Dr. Tedros, the floor is yours.
Yeah. Okay. Technology. Thank you. Your Excellency, Dr. Mohammed Isham Jafar, Minister of Health of Brunei Darussalam and Chair of the Regional Committee, Honorable Ministers and Heads of Delegation, and my sister Susanna Jacob, Excellencies, dear colleagues and friends. Good morning, and it's an honor to be with you. As you know, this is a particularly important moment for the region as member states prepare to elect a new regional director. But before that, allow me to thank the Philippines for hosting our regional office and for all the support, the continued support they're providing. In this very historic regional committee, I'm pleased to note that the region will have either its first female regional director or its first regional director from the Pacific. So whichever way, it will be historic. And I look forward to working closely with whomever you choose. Teleprompter is not moving. I thank Australia for suggesting the candidates forum and other member states for supporting the idea. Earlier this month, the Eastern Mediterranean followed suit. They thought the WIPRO practice is good. And then the Southeast Asia region will also do it this week, 18 October, if I'm not wrong. So thank you so much for taking this Candidates Forum initiative. It's already taken by the two regions who will be electing their RDs as well. And the Secretariat intends to submit a proposal to the Executive Board to revise the guidance for elections of regional directors based on this experience, which brings transparency to the election process. So again, thank you so much to WIPRO and to all members. But my also special thanks to the chairperson, Honorable Buffon of Lao, the outgoing chair, for his leadership in starting it, along with other member states for supporting the idea. So I'd like to thank him for that and for his leadership. I know the past year has been very difficult one for the region, especially for staff here in the regional office. So I would like to be on record expressing my deep gratitude to all staff in the regional and country offices for your dedication, professionalism, and continued commitment to serving the people of the region despite these difficult and uncertain times. I would especially like to thank my sister Susanna, who must have thought her days as a regional director were behind her. But she has stepped willingly into a very difficult role at a very difficult time, and I know how much member states and the staff of the regional and country offices appreciate her. And by the way, without forgetting, like the saying goes, there is a woman behind every successful man, and there is also a man behind every successful woman. And her husband is here, and just amazing support he gives her. We need to recognize Dr. Jacob in his own right, a surgeon. And yesterday he was telling me he did 18,000, 80,000 surgeries. So he is here, and I think Philippines, you have some precious hand in your hands. So I think it would be important to use it. And I know Minister was negotiating yesterday. Excellencies, and then to Susanna, maybe from the little Hungarian I know, I would like to say to you and your husband, Kosenem. Thank you so much. Excellencies, colleagues, please stand and join me in expressing your thanks to Dr. Susanna Jacob. Thank you. Thank you very much. Excellencies, distinguished delegates, last month's United Nations General Assembly in New York was a historic one for health, with 3 high-level meetings on health issues. Member states approved strong political declarations on pandemic prevention, preparedness and response, universal health coverage, and tuberculosis. All 3 are relevant to the work of this region. And all 3 depend on a strong WHO and a strong region of the Western Pacific. Over the past 6 years, WHO has undergone the most significant transformation in its history, grounded in a bold new strategy, the 13th General Program of Work. As you know, we're now working with member states to develop the 14th General Program of Work for 2025 to 2028. In my address to the regional committee last year, I outlined 5 priorities, the 5 Ps, which are now becoming the basis of GPW 14 to promote, provide, protect, power, and perform for health. A few words on each. The first priority is to promote health and prevent disease by addressing its root cause in the air people breathe, the products they consume, and the conditions in which they live and work. This is especially important for the prevention of non-communicable diseases, which account for almost 90% of deaths in the region. Action to reduce tobacco use, improve diets, and increase physical activity must be key priorities for all member states, as must be action to reduce emissions to address climate change, which is a threat to all nations, but especially to our friends, brothers and sisters in the Pacific. I'm very much looking forward to COP28 in the United Arab Emirates in December, which for the first time will include a day dedicated to health. I encourage all member states to participate actively. Not only your participation, Your Excellencies, please also encourage the heads of state and heads of government to join us during the Health Day. Empowering people to make healthy choices depends on them having reliable information. So I welcome the Regional Action Framework on Communication for Health, which you will consider this week. The second priority is to provide health by radically reorienting health systems towards primary health care at the foundation of universal health coverage. The most recent edition of the Global Monitoring Report on Universal Health Coverage, published just a few weeks ago, shows that the Western Pacific enjoys one of the highest rates of service coverage in the world. Although, of course, there are significant differences between member states. As a result, you have made significant progress against several indicators, including reproductive, maternal, newborn, child, and adolescent health, and against communicable diseases. I congratulate you for the significant declines in malaria cases and deaths you have achieved, especially in the Mekong region. It's also pleasing to note that Western Pacific enjoys the highest antiretroviral treatment coverage for HIV of any region. I also congratulate Lao PDR for being verified for the elimination of lymphatic filariasis. However, while service coverage and health outcomes are improving, the latest UHC data also show that across the region, catastrophic health spending has increased alarmingly, exposing many individuals and families to financial hardship as a result of having to pay for care out of their own pockets. So high out-of-pocket payment is a serious problem in the region, and I hope you will focus on this issue and address it. So I urge all member states to focus on financial protection for your populations. The backbone of a strong health system is a strong health workforce. So I welcome the regional framework to shape health workforce for the future of the Western Pacific, which you will consider this week. The third priority is to protect health by preparing countries to mitigate health risks and to rapidly detect and respond to both acute and protracted health emergencies. Just last week, I was in Cairo, the regional committee meeting of the Eastern Mediterranean. The region bears a heavy burden of health emergencies, including the conflict in Israel and the occupied Palestinian territory, which erupted just over a week ago. We can all be grateful that this region does not suffer to the same extent from violent conflict. But as the regional director's report notes, there are many other emergencies to which you have responded in the past year, including earthquakes, cyclones, typhoons, volcanic eruptions, tsunamis, and food safety incidents. I welcome the Asia-Pacific Health Security Action Framework, which you will consider this week. Meanwhile, regionally and globally, the same vulnerabilities that COVID-19 exposed persist. During the pandemic, all countries built new capacities to prevent and control epidemics and pandemics. I urge all member states to sustain those gains and not slip back into the cycle of panic and neglect. The investments you have made must not go to waste, and nor must the painful lessons we have learned together. That's why WHO has developed a plan for a more equitable, inclusive, coherent global architecture for health emergency preparedness and response with equity at its core. The new pandemic accord and amendments to the international health regulations will provide the vital legal foundations for this architecture. However, I'm concerned, I would like to underline this. However, I'm concerned that negotiations are moving too slowly and that the accord may not be agreed in time for next year's World Health Assembly as agreed. I urge all member states to work with a sense of urgency, with a particular focus on resolving the most difficult and contentious issues. This is a unique opportunity that we must not miss to put in place a comprehensive accord that addresses all of the lessons learned during the pandemic, with a particular emphasis on equity. This is the generation that lived during the pandemic. We're called the lived community. And this is a generational agreement that should be written by us, by the lived community, that's first-hand experience in fighting this dreadful pandemic. So the deadline is May 2024. I hope you will make it. And promoting, providing, and protecting health are proposed as the 3 key priorities for all member states in the 14th General Program of Work. The other 2 P's, powering and performing for health, are enablers of the first 3. Powering health means harnessing the power of science, research and development, data and digital technologies. And the Regional Health Innovation Strategy for the Western Pacific, which is on your agenda this week, is important for fostering new solutions to health challenges. At the global level, WHO has recently launched the Global Initiative on Digital Health at the G20 Health Ministers meeting in India. The global initiative will support member states by converging and convening global standards, best practices, and resources for digital health transformation rooted in people-centered, evidence-based solutions. And we're preparing well to really support you to make advances in digital health technology. And the final P, performing for health, is about the work we are doing at the Secretariat to support you better. In particular, one of my key focuses for the remainder of my second term is to strengthen our country offices with a core country presence, delegation of authority, adequate financial and human resources, the implementation of global mobility, enhanced internal communications, and more, so that our country offices can support you in a better way. We support them in order to support you based on your priorities. And to support these efforts, I have squeezed $100 million from our budget to allocate to country offices. Our program budget for the next biennium is also the first in which country offices will be allocated more than half of the total budget for the biennium. By the way, the transformation at the country level is being led by the country office heads themselves. And we have strong 6 colleagues representing the 6 regions leading this change. So this is by the country offices, for the country offices. And the role of the headquarters and region is to give them what they're asking in order to do their job better at the country level. And we have already increased funding flows to regions and countries, and the more flexible funding we receive, the more we can increase that amount. Our work to strengthen country offices will benefit greatly from the 20% increase in assessed contributions and by the proposal for an investment round, both of which you approved at this year's World Health Assembly. And would like to use this opportunity to thank you for supporting assessed contribution and also investment round. as part of the sustainable financing reform that we have started. We're also continuing our efforts to strengthen our workforce, to achieve gender equity at all levels, and to make zero tolerance for all forms of sexual misconduct a reality and not merely a slogan. Excellency, Chair, Excellencies, thank you all once again for your continued commitment to promoting, providing, protecting, powering, and performing for health in the Western Pacific. I wish you all a very productive and successful regional conference. I thank you.
Thank you, Dr. Tedros. As you heard during Dr. Tedros' address, Laos People's Democratic Republic is being recognized today for its efforts in eliminating lymphatic filariasis as a public health concern. Congratulations, Laos People's Democratic Republic. Now may I call on the Chief Delegate, Honorable Mr. Bonfang, to join Dr. Tedros at the front for a brief presentation. I understand that Minister Bonfang, our outgoing chairperson, will have to leave shortly to attend to other duties. I would like to offer him the opportunity to make a short intervention on Lao People's Democratic Republic's achievement.
Mr. Chair, Dr. Tedros Ghebreyesus, Director General of WHO, Dr. Susana Chakap, Acting Regional Director of WHO Regional Office in the Western Pacific, distinguished delegates, I thank WHO for recognizing this milestone. For years, people in Laopedia has their lives tragically impacted by lymphatic filariasis. For many, this seems a reality they has no choice but to accept. But now that the threat has gone, eliminating lymphatic filariasis has prevented and will prevent unnecessary suffering for current and future generations in Laopedia. Why the disease was endemic in just one of our 18 provinces. This was one too many. One person suffering was one too many. In 2000, our ministry began prevention and control programs to eliminate the disease. Local health authority and partner distributed preventive medication to at-risk communities from 2012 to 2017. Combined with health education and vector control activity coupled with strong surveillance. Our country achievement has been made possible through years of collective effort by dedicated health workers, together with support from WHO and partners, including USAID, the ASEAN Development Bank, the Margaret A. Kargin Foundation, FHI 360, and RTI International. As a result, we have reached this point. We have been working toward for many years. Lymphatic filariasis will never regain a foothold in our country. We will continue to maintain our efforts to prevent and control the disease through surveillance and respond quickly to any cases. Eliminating diseases is a tremendous struggle, and so often one that might seem impossible, but today is a reminder that we can achieve the lofty goals for better health for all that we strive for. It's a fight worth fighting. It's a fight worth fighting because when we eliminate this disease, we are not just saving life, we are giving people back their hope and their futures. On behalf of the Ministry of Health, I would like to take this opportunity to thank health workers, communities, and leaders for their commitment and their hard work. WHO, our many development partners and donors for their support to reach this goal. I thank you.
Thank you, Minister. On behalf of the Regional Committee, I would like to thank you for your support and leadership over the past year. We are grateful for your exceptional efforts. Thank you. As advised earlier, we will take Member State interventions on the Director General's address together with interventions on the Regional Director's report. Before we break for coffee, we need to take a group photo here in the conference hall. Immediately after the group photo, may I invite my fellow Credential Committee members, the Honorable Vice Chairperson and the two rapporteurs to join me and the Legal Counsel at room 208E to take up the work of the committee. The plenary session will reconvene in 15 minutes. I now call on the Regional Communications Manager to provide the details of the group photo.
Thank you so much, everyone. And thanks so much, Chair, for handing over to me. So as we know, I think many of you are used to the process for the photo, but just allow me to explain it to you briefly. First of all, I wanted to thank you for taking note of the information that was on the screen when you came into the room this morning. Just advising you that, of course, we're taking lots of photos and videos during the Regional Committee meeting this week. Those are going to be live streamed on the web. And also you're welcome to look for photographs of yourself on our multimedia library. You'll find more information about that in the WHO Events app. But as to the official photo for this session, in a moment I'm going to ask Dr. Tedros, Dr. Jakob, and all of our chief representatives from countries to move into the center of this horseshoe. You can see colleagues now setting out the spots so that you know where you need to stand. And while that first photograph is happening, we kindly ask everybody else to just wait in the hallway and in the adjoining rooms here, because we will ask you to come back into the conference hall and shuffle in behind the chief representatives for the second photo, which is going to include everybody. We will try and get this done as efficiently as possible so that we keep you going on time and get you your coffee break, which I'm sure everybody needs by now. So kindly asking the chief representatives to now head inside the horseshoe and find your spots, and everybody else to just kindly wait a few moments in the adjoining rooms, and then we will invite you back in to join us for the second photograph. Thank you so much.
How are you? Yeah.
Welcome back. Honorable delegates, next, I would like to report to you on the credentials for the meeting. The officers of the Regional Committee met today, 16 October 2023, to consider the credentials of representatives in accordance with Rule 3B is of the Rules of Procedure of the Committee. The credentials of the following delegations were found to be in conformity with the rules of procedure as constituting formal credentials. Australia, Brunei Darussalam, Cambodia, China, Hong Kong SAR, China, Macau SAR, China, Cook Islands, Fiji, France, Japan, Kiribati, Laos People's Democratic Republic, Malaysia, Republic of the Marshall Islands, Federated States of Micronesia, Mongolia, Nauru, New Zealand, Niue, Republic of Palau, Philippines, Republic of Korea, Samoa, Singapore, Solomon Islands, Tonga, Tuvalu, United Kingdom of Great Britain and Northern Ireland, United States of America, Vanuatu, Vietnam. The officers therefore propose that the Regional Committee should recognize their validity. I see no objection. It is so decided. Furthermore, the officers examined the communications from Papua New Guinea, which, while indicating the names of the delegates concerned, could not be considered as constituting formal credentials in accordance with the rules of procedure, but rather as provisional credentials. The officers therefore recommend to the Regional Committee that the representatives of this member state be provisionally seated with all rights in the Regional Committee pending the provision of their formal credentials. I see no objection. It is so decided. The officers of the Regional Committee agreed that should any further credentials be received, the chairperson may examine them and report thereon to the committee. We will now move on. Distinguished representatives, the report of the Regional Director, document WPR/RC74/2, covers the work of WHO in the Western Pacific region during the period of 1st July 2022 to 30th of June 2023. Acting Regional Director, Dr. Susanna Jacob, and the directors will together present the Regional Director's report. It is now my great pleasure to invite Dr. Jacob and WHO senior management in the region to address the committee. Dr. Jacob, the floor is yours.
Chairperson, honorable ministers, representatives from member states and partner agencies, Director General of WHO, ladies and gentlemen. Welcome to the 74th session of the WHO Regional Committee of the Western Pacific. We are delighted to see you all in person in Manila. I would like to congratulate and thank the incoming chairperson, vice chairperson, and rapporteurs for agreeing to serve in these important roles. 2023 has been a year of celebration for WHO as we mark our 75th anniversary. In 3/4 of a century, much has changed in the Western Pacific region, and I am glad to say much of it for the better. More babies are celebrating their birthdays, and life expectancy has increased by some 30 years. Smallpox has vanished, and we are this close to ending polio. Death from malaria has plummeted. Vaccination is reaching an impressive 93% of children. And we are celebrating more disease eliminations, such as the elimination of the lymphatic filariasis in the Lao People's Democratic Republic, which we recognized earlier today. I encourage each of you to walk through the photo exhibition just outside the conference hall. It provides a snapshot of our joint achievements since the organization's founding in 1948. Our legacy has improved the lives of families, communities, and countries. Yet, we recognize we are only as strong as our foundation. We have recommitted to work more intensively at the grassroots level, hand in hand with countries, communities, and partners. And we are more focused than ever on achieving results and impact in the countries on our road towards health for all. While 2023 has been a year of celebration, it has also been a year of hard work, challenges, and transition. In August 2022, the Director General asked me to step in as officer in charge. And this past March, the Regional Committee asked me, upon nomination by the Director General, to serve as acting regional director until a new regional director takes office next February, following this week's nomination. I accepted this new challenge, and I am grateful to member states of the region and to the DG for their trust. Thanks, DG, for your kind words earlier today. Transitions are not easy, yet we have worked hard to ensure progress in this great region, where member states are solidly committed to improved health outcomes and stronger and more resilient health systems as part of their sustainable development agenda. While working together to advance regional priorities and plans endorsed by the Regional Committee. The unity on health issues in this region and among the member states is amazing. The report of the regional director, which you have in front of you, shares the work of WHO in the Western Pacific from 1st of July 2022 to 30 June 2023. It conveys how we have been working to address the health challenges of today and ensure a healthy future for the region's 1.9 billion people under the regional vision, which you adopted in 2019. As you know, this vision sets out priorities for the work of WHO with member states and partners. It is directly aligned with WHO's global vision as well as with the Sustainable Development Goals. In this region, we are specifically working to target the health challenges and opportunities of today and those we are likely to encounter in the future, and to address the root causes of health inequities. The vision's 4 thematic priorities, as you can see on the slide, address the critical issues of today and tomorrow. The strategic direction of our work is centered on making health systems more resilient and reorient them towards primary health care, which lays the foundation to achieve universal health coverage and also ensures the sustainability of health emergency preparedness and response. This work will be greatly accelerated by the DG's initiative to further strengthen country presence. I would like to thank Dr. Tedros for supporting WHO in the Western Pacific through an additional $18.7 million to set up 54 core predictable country presence positions in this region. For more than 3 years, the COVID-19 pandemic has dominated the efforts of WHO and member states. On 5th of May 2023, following the recommendations of the COVID-19 Emergency Committee, WHO declared an end to the pandemic status as a public health emergency of international concern. We are forever indebted to the inspirational legions of healthcare workers, researchers, policymakers, and others who have been at the forefront of the pandemic response and have been instrumental in reaching this milestone. And thanks to the collective efforts across the region, we fared relatively well. Compared to other regions, we were able to protect our communities and societies from the onslaught of the acute phase of the pandemic. The pandemic provided a forceful reminder that health is intertwined with the economy and the success of societies. This knowledge and the hard lessons learned are guiding the region to ensure that health is an essential partner in sustainable development in the future, with primary health care central for safeguarding of health and well-being of all members of the society. The region has shown progress and resilience in the face of challenges. Yet, we are reminded that we still have much to accomplish. The region is vulnerable to impacts of climate change, the increasing burden of non-communicable diseases, and threats of other public health emergencies. It also continues to be a hotspot for emerging diseases with pandemic potential. To ensure organizational preparedness, integrity, and the agility to achieve future goals, we have been looking inward at how we can develop and strengthen the WHO workplace to be a source of pride for everyone. A large part of our work has been directed towards this end. We have accelerated the rollout of the Global Transformation Initiative and have worked towards positive organizational and cultural changes to ensure a well-functioning, sustainable, and respectful workplace that delivers high-quality work for the member states of the region. My aim is to hand over a sustainable, well-functioning, and respectful workplace to the next regional director that you will nominate this week, in which colleagues feel appreciated and are happy to come to the office every morning. We are seeing positive change internally with zero tolerance for any inappropriate behavior, wider awareness and engagement amongst colleagues on sexual misconduct, and respect for policies, as well as a commitment and respect for WHO policies on abusive behavior and sexual misconduct, the Code of Ethics and Professional Behavior, and the WHO Values Charter. All of this enables us to be better prepared and drive impact for the countries we serve. During the course of the week, we will give you more information and insight into these initiatives that have occupied a large part of our work. This is an important investment in the regional office and country offices because the staff is our greatest asset, and we have to do everything we can to create a positive and respectful environment for them to thrive. Recently, we also signed a memorandum of understanding with the president of the Association of the former WHO staff members to recognize and institutionalize our partnership and to acknowledge and harness the potential of retirees and former staff to the work of WHO. Their experience and wisdom will help us further to achieve our goals. I thank member states for their support and trust in me during my time in the region. During such a challenging and celebratory period, marking the organization's anniversary, the consideration and collegiality of representatives of the region have made this work so rewarding and fruitful. It has been a true privilege to be welcomed into this region, and I have enjoyed meeting so many of you and hearing of the incredible and diverse work occurring across the region. I'd also like to thank the outgoing chairperson, Honorable Minister Buom Feng, for all of his great support to the regional committee over the last year. I think we have asked more of him over these complicated 12 months than any other chair before. Ladies and gentlemen, I would now like to invite our technical directors to share with you how we are working together to deliver on our commitments to you, our member states in this great region. Let me first invite and hand over to Dr. Babatunde Olobokur, our Regional Emergencies Director of the WHO Health Emergencies Program and Director of the Division of Health Security and Emergencies. Over to you, Dr. Olobokur.
Thank you, Dr. Yaku. Excellencies and distinguished guests, as you are all aware, our primary concern over the past 3 years has been SARS-CoV-2, or the coronavirus that causes COVID-19, and is responsible for the COVID-19 pandemic. SARS-CoV-2 and its associated variants and subvariants have presented us with one of the most daunting public health challenges faced by WHO since its founding in 1948. In this region, we built upon the decades of regional solidarity and advancement in health security capacities and systems within countries. As such, it is widely recognized that this region performed comparatively better than others in its response, particularly in the early phases of the COVID-19 pandemic. WHO has worked to ensure that all efforts are focused not only on the sustained management of COVID-19, but also on preparing for the next pandemic or public health emergency. Although the end of the pandemic-related public health emergency of international concern was declared in May 2023, our work with member states will have long-term sustainable impacts across the region. These include building national capacities to manufacture medical oxygen for patients, developing and strengthening emergency medical teams, and rapidly expanding whole genomic surveillance capabilities. We have also developed new partnerships while at the same time maintaining, strengthening, broadening, and deepening our work with established partners. In addition to responding to COVID-19, WHO continued to address a wide range of other health security concerns. In July 2022, the Director General, on the advice of the Mpox Emergency Committee, declared the outbreak of Mpox a public health emergency of international concern. WHO launched an immediate response to stop transmission and to protect at-risk groups. This included disease epidemiology investigations, laboratory support for the procurement of testing materials, communication of public health advice to the public, and the establishment of pathways for the referral of samples for testing. The Mpox emergency was lifted in May 2023. Additionally, WHO worked closely with Cambodia when human cases of avian influenza H5N1 were reported, and with the Philippines in response to an outbreak of cholera. There were unprecedented spikes in cases of dengue in Cambodia, the Lao People's Democratic Republic, and also in Vietnam. And we have seen a resurgence in cases of influenza respiratory syncytial virus or RSV, and diphtheria. Over the past year, the region has also experienced 39 food safety incidents, including botulism outbreaks, monitored through the International Food Safety Authority's network. In addition, during the reporting period, the region has experienced earthquakes, heat waves, floods, droughts, cyclones, typhoons, and volcanic eruptions. Typhoon Mawar and tropical cyclones Judy and Kevin in the Pacific resulted in damage or destruction of healthcare facilities, other infrastructures, homes and communities, causing deaths, social disruptions, and economic losses. Such events are becoming more frequent, more complicated, and more destructive, requiring coordinated multi-sectoral responses to such complex situations and to strengthen the resilience of health security systems at the subnational, national, and regional levels. Which is why, together with member states and partners, WHO has developed a bi-regional health security framework to build on the achievements of the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies, or APSED, so that countries are better prepared and ready to detect, respond to, and prevent outbreaks, epidemics, and other multi-hazard public health emergencies. The framework will be considered for endorsement by the Regional Committee this week. Thank you, Dr. Jacob.
Thank you very much, Babatunde. Let's now turn to Dr. Rajendra Yadav, Acting Director for the Division for Disease Control. Over to you, Dr. Yadav.
Thank you, Dr. Jacob. Despite the impact of the pandemic, the region has made significant progress over the past year on several fronts in efforts to respond to health risks from disease threats and to prioritize efforts to expand essential health services to reach unreached populations. In the fight against neglected tropical diseases, the elimination of trachoma in Vanuatu and lymphatic filariasis in Lao PDR were validated in October 2022 and February 2023, respectively. The region continues to make a huge contribution to the global effort to eliminate malaria. China was certified as malaria-free by WHO in 2021. Now Cambodia, the Lao PDR, and Vietnam are close to elimination and will begin preparation for malaria-free certification status soon. Further, during the reporting period, the Western Pacific region had the highest coverage of all 6 WHO regions, that is 79%, for antiretroviral treatment for people living with HIV. Overall population immunity against poliovirus in the region remains high. Despite outbreaks of circulating vaccine-derived poliovirus, the region maintained its wild poliovirus-free status. And in all, 4.8 billion doses of COVID-19 vaccines were administered in the region, prioritizing the most vulnerable populations. 29 countries and areas in the region achieved the global target of vaccinating at least 70% of their populations. Australia is on target to be the first country in the world to eliminate cervical cancer. WHO is supporting countries to develop national action plans to combat non-communicable diseases, to integrate essential non-communicable disease services into primary care. To support those affected by mental health issues and substance use disorders, we continue to support countries to advance new ways of working in a transformative environment for mental health, focusing on community-based approaches. These are just some successes that can be traced to the adoption of innovative health system approaches that integrate service delivery, employ cross-sectoral efforts, have strong community leadership, and promote meaningful partnerships. More still needs to be done one of our major challenges going forward is to support member states to identify unreached populations and serve them through integrated systems approaches that strengthen primary health care.
Thank you, Raj. Next, I'd like to introduce Dr. Kidong Park, Director of the Data Strategy and Innovation Group. Dr. Park, you have the floor.
Thank you, Dr. Jakob. Building on past activities and then efforts, the Data Strategy and Innovation Group has supported member states over the past year in two key areas. The first is harnessing the power of the data, digital technology, and innovation. And the second is accelerating health system transformation towards achieving universal health coverage. In helping to harness the power of the data, WHO publishes the Data Management Competency Framework to assess competencies, identify gaps, and develop capacity building plans. The framework was used in Papua New Guinea to identify data management competency gaps at various levels of the health system and inform the development of the training plans to address those gaps. WHO assisted the member states in transitioning disease and cause of death classification system to the International Classification of the Diseases 11th revision, ICD-11. DSI provided support in developing ICD-11 transition plans for Malaysia and the Philippines, as well as a series of the orientation sessions for Pacific Island countries and areas. With WHO support, the Lao People's Democratic Republic launched its first ever digital health strategy. DSI also supported member states to harness innovation. A collection of the case study was created, one of which focused on innovative solutions for providing cataract surgeries to vulnerable population in Malaysia. This week, we will present the draft regional health innovation strategy for the Western Pacific for your consideration and endorsement, which has been developed to solve problems, accelerate impact, and shape the future of the health and well-being. In accelerating health system transformation towards achieving universal health coverage, we supported the member state in using the three-dimensional UHC approach. This approach focuses on health systems, data for decision-making, and integrated service delivery to guide health system transformation. We also initiated the development of a UHC roadmap implementation guide. The guide is designed to support member states in systematically transforming health systems towards achieving universal health coverage. Thank you.
Thank you, Kidong. We have heard some of the innovative, forward-looking, and impactful work being done across the region to drive impact in the countries. It is very impressive to see not only the great progress which has been made despite the impact of the COVID-19 pandemic, but also how the region has used the opportunities presented by the pandemic to sustainably drive other health priorities. Let us now turn to Dr. Hiro Okayasu, Director of the Division of Healthy Environments and Populations. Dr. Okayasu, over to you.
Thank you very much. As NCD is a leading cause of death in our region, we are tirelessly working with our member states to accelerate actions on NCD prevention by addressing common challenges and creating enabling mechanisms. WHO supports member states to reduce risk factors for NCDs and injuries through the development and implementation of evidence-based and cost-effective policies. Our engagement and collaboration with the non-health sectors, as well as with the private sector and civil society, has played a crucial role in the effort to create healthier and more equitable communities. So far, 17 countries have adopted policies to protect children from the harmful impact of food marketing. And 15 countries in our region have adopted national legal measures on the marketing of breast milk substitute. And WHO Tobacco-Free Initiative, or TFI, supported countries to implement the Regional Action Framework on Tobacco Control 2020 to 2030. TFI has facilitated the collaboration between the health and financial sectors, and it has built technical and leadership capacity in advocating for health-enabling taxes. Currently, 25 countries and areas in our region have strengthened or enacted laws and regulations on tobacco and nicotine products. TFI has also supported engagement with the finance, tourism, education, and hospitality sectors to implement smoke-free laws and other tobacco control policies. As member states are experiencing significant population aging, we need to build living conditions that support older adult social participation and people-centered health systems that seamlessly integrate non-health services. This transformation would not only help other people in the future, but also have an impact now across all generations. Recognizing that healthy aging is a pathfinder for our future social and health systems, WHO has worked with the member states to develop national policies in advocating for healthy aging, notably in Philippines and in Palau. Furthermore, we have facilitated discussion on creating age-friendly environments and community-based care in Brunei Darussalam, Cambodia, and in Philippines. WHO has also supported our member states in developing management system for water, sanitation, and hygiene, and handling healthcare waste in healthcare facilities with a broad approach that integrates climate resilience and environmental sustainability concerns. Technical program can better achieve programmatic objectives and health equity by addressing the gender differences in risk factors, disease burden, healthcare access, and intervention responses. WHO has published a report highlighting the best practices and lessons learned to support countries in adopting a gender and equity lens. Thank you very much.
Thank you, Hiro. To talk to us about the division of health systems and services, I would like now to hand to Acting Director Luis Vinas-Torres. Over to you.
Thank you, Dr. Jacob. WHO strives to increase access to healthcare and strengthen the resilience of health systems as key element for universal health coverage. To drive primary healthcare reform, different entry points are being used. These range from using an analysis of human resources for health, as Papua New Guinea has done, to emphasizing financial access to outpatient medicines by producing an in-depth country-specific financial protection analysis, as Mongolia has completed. To promote access and increase the supply of safe, efficacious, and quality-assured medical products, WHO provides a pathway for regulatory authorities to be recognized as WHO-listed authorities, or WLAs, operating at an advanced level of performance. The national regulatory authorities of the Republic of Korea and Singapore are undergoing evaluations towards designation as WLAs, while other countries are using the benchmarking tool to map out a plan to strengthen their regulatory authorities. The Ulaanbaatar communiqué, endorsed by parliamentarians attending the 7th meeting of the Asian Pacific Parliamentarian Forum on Global Health, recognize that primary health care is the cornerstone of a sustainable health systems that advance health security, universal health coverage, and health-related SDGs, and urge parliamentarians to advocate for primary healthcare reforms as an investment in countries' social and economic well-being. Improving the quality of maternal and pediatric care is among the highest priorities for reducing preventable death and improving health outcomes. WHO was able to reach more than 50 million people across the region with a targeted social media campaign to promote early essential newborn care amongst parents and healthcare workers during the pandemic and to address infection prevention control concerns. Thank you, Dr. Jacob.
Thank you very much, Luis. Finally, we move to our division of Pacific Technical Support, and let me hand to Dr. Mark Jacobs. Dr. Jacobs, you have the floor.
Thank you, Acting RD. Under WHO's leadership, the coordinated support of partners in the Pacific-wide pandemic response helped to prepare for the onslaught of COVID-19, which swept across the Pacific 2 years after the coronavirus first emerged. By the time the pandemic reached the shores of most Pacific islands, more than 1.7 million vaccine doses had been administered through the COVID-19 Vaccine Global Access Initiative. As a result of this and support from partners, by the time the virus started to spread, many countries had achieved vaccination rates of over 90% of eligible populations. Health workers were trained and armed with therapeutics, and response plans were in place. Plans based on guidance from WHO and lessons learned from the global pandemic response. The measures resulted in much lower cases and death rates than other parts of the world. By the end of 2022, partners had provided more than 35 million items with a value of $54 million to support COVID-19 preparedness and response across the Pacific, including nearly 15 million items valued at more than $21.5 million from WHO. These pandemic efforts will also yield long-term benefits, as the policies, the practices, and the resources now in place because of the COVID-19 response will support future health needs among Pacific Island countries and areas. Strong support to Pacific countries to help them address the growing health impacts of climate change has also been and will continue to be a major focus of WHO's work in the Pacific, such as through our support for efforts to improve climate resilience of health facilities and to better recognise the health co-benefits of climate action. Similarly, helping countries address the escalating burdens of NCDs remains a major focus, and WHO supported a number of Pacific countries to attend and to actively participate in this year's SIDS Ministerial Conference on NCDs held in Barbados. There's increasing global recognition of the need for special approaches to meet the unique needs of small island developing states, exemplified by the World Health Assembly resolution on the outcome of the SIDS Summit for Health, for a healthy and resilient future in small island developing states. WHO will continue to support the Pacific to address these and other health challenges and build health system resilience.
Thank you very much, Dr. Jacobs. As you have heard from our directors, everything we do in this region is centered around putting countries first. This is in line with the WHO Transformation Initiative, the most ambitious reform initiative in the organization's 75-year history, led by Dr. Tedros. WHO has developed the Global Action for Results group to make WHO reliable, impactful, and relevant in every country. Part of this effort is an initiative to strengthen the delegation of authority to WHO representatives, granting them the decision-making power they need to be agile and responsive to country needs. Another notable aspect is the development of the core predictable country presence model that I mentioned earlier, which ensures that each WHO country office has the right people in place to facilitate impact. A further element of this work involves making our planning process more strategic by focusing on country priorities and providing support from headquarters and regional offices to country offices so that they can deliver on their commitments. Efforts have been undertaken to engage the workforce more deeply in deliberations of the global governing bodies. A governing bodies unit is also being established to better coordinate WHO's work, including its political and strategic aspects, with the countries and areas in the region. WHO is one organization, but we pay special attention to its three-level alignment when developing regional strategies to ensure coordination among headquarters, regional offices, and country offices. We continue to reshape our workplace culture to be one we can all be proud of. We are strengthening existing systems for reporting and responding to abuse, harassment, and other inappropriate behaviors. Preventing and responding to sexual misconduct has been a major focus area with the piloting of risk assessment tools and the development of an action plan covering 2023-2030. The region continues to ensure the effective application of result-based management in planning, strategic resource allocation, implementation, monitoring, and assessment of both human resources and activity work plans. In order to increase the efficiency and impact of our work and reduce the workload of our staff, we also conducted a review of our internal processes. This resulted in a management action plan and the establishment of a change management group that works alongside the regional director to drive this work and other culture and behavioral change initiatives forward. The Secretariat will deliver as much as it can during the next 100 days and hand over the more medium and long-term actions to the incoming regional director. Honorable ministers, distinguished delegates, as you can see, we have had a busy and productive year addressing the health challenges across the region and driving the implementation of our shared commitments. As we commemorate 75 years of WHO's remarkable journey, we are reminded of the immense progress we have made together. And in this important election year, I am sure that the regional director you nominate tomorrow will be up to the challenge of ensuring that WHO in the Western Pacific is in good stead to meet the challenges of the future. On behalf of the Secretariat, I would like to thank you, our member states, and our partners for your unwavering support and commitment to making the Western Pacific region the healthiest and safest region in the world. Thank you for your attention.
Thank you very much, Dr. Jacob and Directors. We now go to distinguished representatives for the comments on this agenda item and the Director General's address. Please indicate you wish to speak by clicking the big button on your microphone. Accordingly, my call on Philippines to be followed by Japan. Thank you. I give the floor to Philippines, please.
Thank you, Mr. Chair. Honorable Director General Tedros Adhanom Ghebreyesus, esteemed representatives from the Western Pacific member states and from international organizations, it is an honor to welcome you all to the Philippines. Our delegation congratulates Dr. Susana Jacob and all WHO regional staff for their dedicated leadership that strengthened the Western Pacific region's cohesiveness in the face of very trying times. We appreciate the WHO reports on its work in the region, which highlighted collaboration to strengthen preparedness and response to health emergencies. We are humbled by the recognition given to the Philippines as one of the vaccine victories for sustained laboratory surveillance for vaccine-preventable diseases, including polio, measles, rubella, Japanese encephalitis, and rotavirus. Moreover, we congratulate the World Health Organization's special initiative for mental health team in the Philippines, which received the WHO Director General's Award in 2022. The Philippine President, Ferdinand Romualdez Marcos Jr., has highlighted our commitment to healthier communities and lifestyles. He directed immediate attention to addressing our tuberculosis and HIV burden and stressed the importance of public infrastructure, food, education, health, jobs, social protection, and health inequity. The DG and the RD's emphasis on multi-sectoral collaboration and community engagement absolutely resonates with our 8-point action agenda, which has been developed with various stakeholders as a steadfast commitment to achieve universal health coverage and the sustainable development goals. The strength of our region lies in the ownership and leadership of member states. The Philippines looks forward to the new country cooperation strategy and how we can together to align our national 8-point priority action agenda and provide strategies to promote active roles in regional actions on primary health care, people-centered services, health security, determinants of health, mental health, health workforce, and strengthening health systems. We thank the Secretariat for considering our call for an agenda item on health human resources. Filipino healthcare workers are recognized worldwide for exceptional patient care, and we also have a projected global shortfall of about 10 million healthcare workers, particularly in developing countries. We remain committed to extending health services beyond our borders for island-based solutions to climate emergencies, access to advanced medical and surgical services, and training of health workers. Finally, we appreciate our strong coordination in the intergovernmental negotiating body for the pandemic treaty. The pandemic highlighted the inequities between and within member states. Our solidarity is crucial to address the urgent need for mechanisms to address challenges faced by lower to middle income countries. I wish everyone a productive and empowering regional committee meeting. Thank you and mabuhay to all the member states.
Thank you, Philippines. May I call on Japan and to be followed by China.
Thank you, Mr. Chair, Dr. Tedros, Dr. Jacob, distinguished delegates, ladies and gentlemen. It is my honor to deliver this statement on behalf of the government of Japan as Parliamentary Vice Minister for the Ministry of Health, Labor, and Welfare. This is the first regional committee meeting since the public health emergency of international concern for COVID-19 was lifted this May. First and foremost, I would like to thank and commend Dr. Jacob, the leadership, and the wonderful staff of WIPRO for their tremendous effort and contribution to combat this pandemic over the past several years. The mortality rate of the Western Pacific region, as reported in the Lancet, was by far the lowest compared to other regions. And this is thanks to the tremendous effort, tireless support by WIPRO through information sharing, technical advice, groundwork, and long preparation and cooperation incorporated into the design of the Asia Pacific Strategy for Emerging Diseases that we have all worked on to prepare. We believe that the collective expertise and experience accumulated at this office through these challenging years will surely become an ongoing valuable asset to all of us member states as we prepare for the next public health crisis. Another important theme for the WHO is the advancement of universal health coverage, or UHC, which has been a long goal for Japan even before the pandemic. Emphasizing the importance of preparedness for health emergencies during peacetime is a lesson that we have all learned through COVID. Against the challenges of the slowdown of progress during the COVID years, at the United Nations General Assembly high-level meeting on UHC held this September, Prime Minister Kishida demonstrated Japan's strong determination to continue to lead the efforts of the global community to achieve UHC by 2030, highlighting UHC's importance for pandemic prevention, preparedness, and response. Finally, during this pandemic, we were all reminded of the critical role that WIPRO can and must play in the face of a global health crisis. The hard lessons learned shall guide us through any challenges that we may encounter in the future. And Japan promises to continue to support WIPRO under the new leadership to continue to offer the top caliber of experience, expertise, and capacity to protect our region. Thank you very much for your attention.
Thank you, Japan. Now my call on China.
Thank you, Mr. Chair. China thanks the Director General and the Acting Regional Director for their work reports. The Chinese delegation appreciates the comprehensive analysis into and a summary of the progress made and the challenges remained in addressing various health issues. China would like to thank Dr. Susanna Jacobs, Acting Regional Director, and the Regional Office for their work over the past year. The report of the Regional Director points out the need to further strengthen country office capacities and mandates and to enhance coordination among headquarters, regional, and country offices. A full testament to country focus. China welcomes this focus. China notes the recent WHO reform on sustainable financing. China calls for greater flexibility in the use of voluntary contributions so that WHO can focus on important and pressing public health issues and set the international health agenda in a professional and neutral manner, step up support for health development in member states to achieve the 2030 Agenda for Sustainable Development. At the same time, WHO needs to improve the efficiency of its management and governance and boost transparency and inclusiveness. The Chinese government has always given priority to the health of the people in its development strategy and has always been people-centered and committed to serving the health of the people. We have pushed forward the building of a healthy China in an all-round way, deepened the reform of the medical and health system, built the world's largest medical and health service system, and improved the health financing system. With a population of more than 1.4 billion, China's health achievements have laid a solid foundation for the early realization of health-related SDGs in this region. At the same time, China actively participates in the reform and development of the global governance system, upholds true multilateralism, and firmly supports WHO's central leadership and coordinative role. We have signed a new round of the country cooperation strategy with WHO. This year marks the 75th anniversary of the founding of the WHO and the 60th anniversary of China's provision of foreign medical teams. During the past 6 decades, 30,000 over medical team members with their skills and compassion served 290 million people in 76 countries and regions, bringing health and safety to local people. An African president used to say this to our Chinese ambassador: 1 out of 4 African has been served by a Chinese doctor. This is a great effort made by China and tangible efforts for China's contribution to promoting the highest attainable standard of health for all. China will continue to actively support and participate in the WHO reform process, work with regional members to realize the vision for the future towards the safest and healthiest region, and promote the building of a health community for all. Thank you, Mr. Chair.
Thank you, China. We will now suspend this item and break for lunch. We will resume consideration of this item immediately after the private meeting this afternoon. Thank you very much. And before we take a break, may I call on the Acting Director, Administration and Finance, for the administrative announcement.
Thank you, Mr. Chairperson. I would first like to make a few announcements about the planned proceedings for the rest of the day. Daily Journal is now available on the WPRO RCM website and the WHO Events app. It is also available upon request at the inquiry desk. Starting today, daily lunch for all participants will be served at the cafeteria, located at the ground floor of the main building. May we kindly request those seated in the outer horseshoe as well as those in the balcony to carry your personal belongings as we prepare for the private meeting to be held after the lunch. So the afternoon session will convene at 14 hours in private session and will have no live stream. Attendance at the private meeting is limited to member states and areas and essential secretariat staff. Once the private session is over, the plenary session will convene. An announcement will be made over the speaker system. Now, a few more general announcements. For security reasons, we do ask that you do wear your badges during the session and the receptions. Those who have not received their badges may proceed to the inquiry desk located at the foyer of this plenary hall. Building layouts are available at the inquiry desk for your convenience, and WHO staff are there to assist you for any questions you may have. WHO Events app also has this information. As part of Wipro's ongoing green initiative, we are reducing documents being printed. RCM documents are available both on the RCM website as well as WPRO Events app. But again, if you do need hard copies, please let us know. Draft resolutions will be made available at the RC74 SharePoint portal as of tomorrow morning. Thereafter, limited number of hard copies of draft resolutions / conference papers will be at the inquiry desk located at the foyer of the conference hall. All documents will be made available online as well. QR codes linking to specific publications published digitally on WHO's IRS repository can be accessed next to their display copies at the publication desk stand outside this conference hall. Hard copies can be ordered upon request to the publication unit. There is an internet cafe located in the lower lounge of the conference hall. Wireless internet connection is available throughout the regional office. Details are available at the inquiry desk. The transport schedule from the hotel to the meeting and vice versa will be posted every day in the lobby of your hotels. Please leave wireless receiver and headset in the conference hall for every coffee break and at the conclusion of each session. The list of representatives will be sent by email today. If you can kindly verify the information of your delegation to ensure the accuracy of your official list and submit any updates and corrections by return email within the day. Lastly, I would like to remind all visitors of our no smoking policy on WHO premises. Thank you, Mr. Chair.
Thank you, Mr. Agarwal. We will now break for lunch. We now take our lunch break and reconvene at 1400 hours for the private meeting this afternoon. Thank you very much.